It starts in a quiet room that smells like antiseptic. A man sits on the edge of a hospital bed. Paper gown, cold air. A doctor walks in, glances at a chart for 3 seconds, and says, "We should run a few more tests, just to be safe." That sentence sounds harmless. It rarely is. Because in modern healthcare, just to be safe is not only a medical decision, it's a psychological one. And sometimes, a financial one. Here's the uncomfortable truth. Studies across multiple healthcare systems have shown that up to 20 to 30% of medical procedures and tests may be unnecessary. Not fake, not illegal, just not strictly needed. So the question isn't whether doctors help people. They do. The question is, what invisible forces quietly shape their decisions? And why do smart, well-trained professionals sometimes recommend things you don't actually need? Let's break it down. Imagine you're a doctor. You've spent over a decade studying. You're surrounded by risk every day. One wrong call could destroy a life or your career. Now add one more variable: uncertainty. Medicine is not math. It's probability. A patient walks in with chest pain. There's maybe a 5% chance it's something serious. 5% sounds small, but if you're wrong, it's catastrophic. So what do? You order more tests. Not because you're greedy, because psychologically, humans are wired to avoid losses more than they value gains. It's called loss aversion. Missing a diagnosis feels worse than overtesting. So the system quietly pushes doctors toward doing more, even when doing less might be medically reasonable. Now layer in something else: time pressure. In many hospitals, doctors have about 10 to 15 minutes per patient. That's not enough time to deeply analyze every case, explain every nuance, and build trust. So they rely on shortcuts, heuristics, patterns.
If symptoms look even slightly like something serious, they escalate. More scans, more labs, more referrals. Because thinking slowly takes time, and time is the one thing the system doesn't give them. But here's where it gets more complicated. Money enters the room. In some healthcare systems, hospitals and clinics are paid per procedure, not per outcome, which creates a strange incentive. More tests, more treatments, more revenue. Now, no doctor wakes up thinking, how can I make extra money off this patient? That's too simplistic. The psychology is subtler. When a system rewards a behavior, over time, that behavior feels normal, routine, even necessary. So ordering an extra MRI doesn't feel like overuse. It feels like good care. And then there's something even more human: authority. When a doctor speaks, most patients don't question it. They nod, they agree, they comply. Because from childhood, we're conditioned to trust medical authority. White coat, confident tone, technical language. It creates a power imbalance. Not malicious, but real. And in that imbalance, patients rarely ask the one question that could change everything. What happens if we do nothing? Let's talk about another hidden mechanism: defensive medicine. This is where psychology becomes almost paranoid. Doctors know they can be sued, even if they're right, even if they followed guidelines. So they practice defensively, ordering extra tests not because they're necessary, but because they create a paper trail. Proof, evidence that everything possible was done. It's not about healing. It's about protection. And ironically, this can expose patients to more risks: radiation, false positives, unnecessary procedures that lead to complications, all in the name of safety.
Now,
Here's the part no one likes to admit. Doctors are human, which means they're influenced by the same cognitive biases as everyone else. Confirmation bias. If they suspect something early, they subconsciously look for evidence to support it. Anchoring. The first impression sticks, even when new information appears. Overconfidence. Years of experience can sometimes make rare events feel more predictable than they actually are. None of this is intentional, but it shapes decisions in ways that feel invisible, even to the person making them. And then there's the industry around them. Pharmaceutical companies, medical device manufacturers, insurance structures, guidelines committees, each one with its own incentives, pressures, and narratives. Individually, they make sense. Collectively, they create a system where more care often means more intervention. Not necessarily better outcomes, just more activity. So now you have a system driven by fear of missing something, pressure to act quickly, financial incentives, legal risk, and human bias. And all of it points in one direction. Do more, even when less might be enough. But here's the irony. Patients don't want more tests. They want certainty. Doctors can't give certainty, so they give action instead. Because action feels like control, even when it isn't. This doesn't mean you shouldn't trust doctors. It means you should understand the system they operate in. Because once you see the psychology behind it, something changes. You stop hearing recommendations as absolute truths and start hearing them as decisions shaped by risk, pressure, and incentives. So the next time a doctor says, "Let's run a few more tests, just to be safe," there's a question hiding underneath that sentence. Not about medicine, but about probability, about incentives, about human nature. And it's a simple one. Are we solving a problem or just making ourselves feel safer?